Shall I get changed?
Hi, everyone. We're just waiting for a few more people to jump on. I'm not sure if you're able to speak with this setting. So if not, is someone able just to write in the chat that you can hear me okay and see everything okay? Great, thank you so much. Okay, so we might actually get started. So we're going to start with a little lecture about posture and things, and I'll go through that in a second. And you might see someone just walking in a second, Penny, who's going to be assisting me on the course as my model. And I am going to be running through a lecture to begin with, but also then going through a practical component where I teach a few exercises individually and then through a class plan. So if you are in a space where you've got a reformer, feel free to jump in and join in with the class, and hopefully I'll cue well enough to give you guidance while you're doing it as well. And if you want the class plans, please feel free to just reach out to APPI. I'll have them there for Sarah to send out if that's something that you want. So hopefully, technically, I've got everything sorted. I'm just going to share my screen now to the PowerPoint. And please feel free just to write in the chat if something goes wrong, or if you're not sure, if you want me to repeat. Sometimes when I get nervous, I talk too fast. So if you feel like I'm going too quick, please tell me and let me know. Okay, so as I said, this is the APPI Reformer Pilates workshop, and today we're working towards creating a plan and a program for someone who, I say a desk worker, but someone who sits at the computer all day, and whether that's their job or as a hobby, I think this is something that we can use for the majority of our patients and clients. So my name is Riley, and I am a titled sports and exercise physiotherapist. I've got about just over 10 years of Pilates experience, and I've worked with clinical groups, full, big, large groups as well. Probably the maximum only maybe 15 people in a group setting, and one-on-one settings. So I've worked in kind of a variety of environments, which I love. I love the variety that Pilates gives us. I'm also a certified APPI Pilates instructor, and I have a real interest in elite athletes. So I have been the head of medical at Carlton in the AFLW program for 4 years, which was very exciting and a challenge at the same time, and head physio for the Monash VNL team for 5 years prior to that. I've actually just relocated from Melbourne to Sydney, and so I'm kind of in the process of finding the next little group and setting that I want to work with, but that's why I'm doing a bit more teaching and some workshops with APPI, which is really nice. As I mentioned, I will have an assistant on the course today, and that is Penny Dalton. This is her beautiful gym with a setup for Pilates, and she does a lot of one-on-one and group training as well. So it's quite nice to have the variation. So the workshop outline today, we're going to start with the lecture, as I mentioned, and I want to go through a postural analysis and then go further into the desk worker, their typical presentation and the area of focus, and then just briefly talk about cues, reps, and dosage. And I think from teaching that I've done on courses, I think the reps and the dosage can be a little bit challenging to figure out, especially if you don't have a background in sport and exercise type work. So if there are any questions, if I miss it, I'll come back to it at the end. But I will try and answer questions during that segment as well, because I think it's really important to have an understanding of how you can tailor even the reps and the cues to the certain population that you're working with. And then we'll go through some examples of reformer exercises for the desk worker that I was talking about, and that will be where we do individual exercises. And it won't be very flowy because it will be probably stop start just to go through it. But I really want to work and talk about the different cues and the watch points that I focus on when I'm teaching those exercises for this population. And then I've set a 30-minute reformer class, and it will probably go for around there or maybe a little bit longer. And like I said, if you have access to a reformer, please feel free to jump in and try it. In regards to springs, I've tried to make it flow really nicely with just using one or only one change in a spring. But please make sure that if you are doing the class yourself, just change it as you need to. And so I'll just get Penny to jump in the video in a second when she's ready, just so that she can wave and say hi. As I mentioned, this is her beautiful studio that we are using, and she does a lot of Pilates herself and teaches Pilates in this gym. So it's really nice to have her along. So we're going to go now into our lecture about the postural analysis. And I decided to put this part in because I think it's really important to see when you're looking at your individual clients and patients, depending on your area of work, that you have an idea of how to assess someone's posture. It doesn't necessarily mean that anyone has bad posture, and especially if you're not a physio, then the posture analysis doesn't need to be to diagnose anything. And I think that's really important. Even as a physio, when someone comes into the clinic to see me, I might make notes about their posture, but it doesn't necessarily mean that I need to change it or that it's completely the reason why they might have pain or something going on at that time. And so you'll see how I've written standard posture. And in the other slide, I think it's referred to as balanced posture. And those are terms in the APPI manuals. But I think it's a nice way to describe a standard posture, because I think we should go away from using terms like perfect posture or correct posture. Like I said, we all develop different postures as we go through life, depending on structural reasons that we may have been born with or because of what we do in our everyday life. However, it doesn't necessarily mean that there's a perfect posture that we should be back to, because someone could have a posture that you don't think looks the greatest, but they have zero issues. They don't have any pain, discomfort. Everything works well for them. They get through their normal everyday life just how they want to and how they need to with no issues. And then if you go and say, oh, your posture's really bad, then that's giving them kind of bad connotations to work with. And I don't think that's a positive reinforcement of what we want to try and achieve in Pilates, which is just moving and caring for our bodies and keeping us able to continue what we do every day in our lives. I'm just going to check the chat. Perfect. And then we're going to go into the common postural deviations. And again, I have used the APPI manuals for the terms. So depending on your background and how much study you've done and who you've done your studies with, you might have different reference points about this, but it's just the 4 most common postural deviations that we find. And it is really important to also know that these are quite extreme variations, and so that we usually always find people are either crossing over from one to the other or somewhere in the middle. And then we're going into the desk worker posture. So when we assess posture, we use what we call a plumb line, and you might be familiar with this. A plumb line's a cord that creates a vertical line. It has a plumb bob at the bottom. And when we use this vertical line, it helps us assess and measure deviations from that point. So that kind of works into the standard posture, because we want a reference point so that when we're writing things down or noticing something, you want a reference point to go back to. So when we use the plumb line, the 2 common side or views that we use is the lateral, which is your side, or your posterior, which is your back. And so on the lateral side, you'll have the plumb line in line just forward of the lateral malleolus, which is the prominent bone on the outside of your ankle. And when you do it from the back, you'll do it from the midway point between the heel. And the reason we use the foot is that to create the standard measure, you need a fixed point for that vertical line. And the foot is the only part of our body when we're in standing that is in contact with the ground. So it's the only fixed point. So that's why we use the base. Obviously, not everyone has a plumb line lying around, and especially if you work in big areas, then you you might, big group classes, you're not exactly going to pull the plumb line out and get someone to have a stand up and have a look at them. You might use a pole if you're in one-on-one settings, and that's fine. You'll still be able to see the significant findings. You might miss a couple of very small ones, but I would argue that maybe you don't really need to pick those up anyway. But it just would create maybe not the perfect ability to reproduce that same finding, because if you're holding the pole, there's obviously, you could hold it a little bit crooked or anything or something like that. So having something that's quite stable and a fixed point is very helpful, but if you don't, then you just use a pole. So as I mentioned, the standard posture. So we do have there's some reasons why we do have what we call a standard or more optimal posture, and that's to help take stress off tissues and organs in the body. So our spine presents with the normal curves. So you can see in that tiny little picture, we've got the cervical, the thoracic, and the lumbar spine, and then we've got the sacrum at the bottom. So the cervical and the lumbar spine are both lordotic, so they go in that little dip in, and then we have a thoracic and sacral kyphosis, which is slightly more of a C curve that way. And again, we say normal curves with these variations in mind. So there should be a slight curve. So we're not looking for a flat, straight back. We should have a slight lower back curve. That's important because I think a lot of people try and find a really flat lower back, but we're looking for anything in excess of that. So you can see that red line is kind of like the plumb line, and anything that's quite excessive on either side is where you're going to start to notice your variations. The bones of the lower limbs are an ideal alignment for weight bearing, and that's mainly just to stabilize our pelvis, stabilize our legs, making a nice strong base at the pelvis so that we're not then having to shift our weight forward or back to find our center of gravity. The neutral pelvis position is conducive to good alignment of the abdomen, trunk, and extremities below. Same thing, if we have a pelvis that goes too far forward or too far back, then we have to compensate, which I'll go through in the next slide. And then we're putting extra tension on different muscles and joints. The chest and upper back position favor optimal function of respiratory organs. So this is quite an important one. So with our rib cage, our ribs, when we take a breath in, expand, and then underneath that is our lungs. So if our rib cage is really stiff, or our thoracic is really stiff because we've gone to quite a excessive kyphosis and we really rounded through the front of our shoulders, then when we take a breath in, the ribs don't expand as wide, and then neither does the lungs. So then we potentially aren't getting the amount of oxygen that we want into the lowest parts of our lungs, and that's may not create any issue for that person, but it's quite amazing if that person's a runner, or actually, to be honest, just to get through everyday life. But if we want to look at a certain population, if someone's quite active and they're running, then you'll find they will feel a lot better and a lot freer and more able to get through a running or a sprinting session if they've got mobility in their thoracic spine, because they can get air in. So that's a good point to make. And then the head is just erect in a well-balanced position, minimizing stress on the neck and muscles and joints. So I'll go through that because every single variation of our posture has this forward head position, which we all know and probably cue in our classes. So going back to that balanced posture, just to look at a reference point now. So we've got the plumb line down the side, but what we are looking at and what we're trying to always get back to in some form. So we've got optimal deep cervical flexor strength, and we've got lengthened cervical extensors. So the flexors are at the front and the neck extensors are at the back. And often if I turn to the side, we find that we fall into this position. So we can't get a good amount of strength in our deep cervical flexors if our chin is poking up, because our muscles are under length, and then we've got a shortened position through our extensors. So we want to kind of almost tip that and meet that halfway so that we can access these muscles in the front, and we can lengthen and take the pressure off the ones at the back. And often, if I think from a physio point of view, people who get headaches, they often are jamming up through the back here, and they're really tight around their suboccipital muscles because they've been in this position all day. Open chest, which we all know, nice open chest through the front where we're taking the pressure off the pecs. And that also means that we've got a nice lengthened position here, but a shortening position at the back. So we're accessing our muscles at the back of our shoulder blades. the normal spine curves that we've mentioned, sufficient strength of the posterior chain and sufficient length of the anterior chain. The reason I wrote this is obviously we want sufficient strength and length throughout the body, but I do find that we're quite weak on the back of our body and we are often quite tight on the front. So we think about hip flexors versus glute strength. So often hip flexors feel tight and glutes feel weak. So that's the most common pattern. So we want to try and find that, and that will also adjust how our pelvis is. So the neutral pelvis at rest, which I'll get to, and then sufficient joint range of motion. I've written not hypermobile, and I don't mean to say that you can't be hypermobile, but you want to make sure that if someone is hypermobile in their joints, so whether that's structurally, so that they're actually born hypermobile and they have a more joint play, or if it's a postural hypermobility because they don't have strength around the joint to stabilize, you want to have sufficient stability. So you want to feel like, when we talk about don't lock your knees out, I almost don't say that because I don't want them to always keep a little bend in their knee. But what I want them to do is make sure that they can lock out or straighten their knee with control. So when they're doing their footwork, that when they push out to straighten their leg, that they aren't just locking out and falling into the joint, that they're straightening the leg and the quad is doing that work for them. So going into some of these, oh, sorry, actually one more thing. So this ice cream, which is, would have been funny to just go past that. This I thought was quite a nice visual way to think about posture. So if you look at the ice cream on the left, you can think about 3 scoops of ice cream, and we've got 1 scoop is the head neck complex, the trunk is the second scoop, and then the pelvis is the bottom, and then the cone is your legs. So if you look at how they are nicely stacked on top of each other, then all of a sudden you've got a beautiful ice cream and nothing is taking too much tension. So each part of the ice cream is taking equal load and there's not increased stress anywhere. If you look to the one on the right, where you have a change in that position of the top ice cream scoop, all of a sudden, if that one's to the right, then the one underneath it has to move to the left to compensate and even out the weight. And then the one underneath that has to go the other way again. So if we think about bodies, that's quite an important thing to note, because if I'm looking at, for example, the pelvis, and I think they have a posterior tilt, so they're tucking under and they're shifting backwards, then probably higher up, they're going to have a flared rib cage because they're having to compensate and change that center of gravity to keep them upright. Otherwise, they'd start to shift backwards. So you want to make sure that you're looking above and below, even if there is something quite significant that's sticking out in your postural assessment. And then going into the variations. So sway back posture, like I said, these are quite extreme. You can see this plumb line. It's quite an extreme variation, but it's a good way just to look at it. So a typical presentation here was we've got the forward head position and weak, deep neck flexors. We've got the shortened chest muscles through the front here, so we're rounding our shoulders. We've got an excessive thoracic kyphosis, so rounding through the mid-back. Weak trunk muscles, because these muscles are under length, so we're nice and long through the front and they're tucked under at the back. So as I was saying with the neck, your abdominal muscles can't work if they're in a lengthened position. They can't work optimally anyway. It's harder for them to shorten from a really lengthened position, whereas if they're at rest, they can shorten a lot easier. So then from the posterior tilt, we're getting the compensation there. So the abdominal muscles are under length and the posterior tilt is then creating a shortening at the hip extensors and hamstrings. The hamstrings may also be tight, which is pulling that pelvis into a posterior position. So the hip flexors are then weak because, again, they are lengthened at the front and they can't activate. So they might be tight. So remember, you can have tight and weak muscles at the same time. It doesn't mean tight and short. But so this sway back posture is mainly seen in that posterior tilt, a compensated trunk shift, and then weakened abdominals. You'll see that all areas, all postures have this forward head position. So when we're looking at how to create a class for these people, we want to look at stretching out the extensors, stretching through the front of the chest, stretching their hamstrings, and then working straight and onto the strength component of their deep cervical flexors, their upper back extensors, their external obliques, but abdominals as well, and their hip flexors. So now we're going into the kyphotic lordotic posture. Same thing, so forward head position, weak, deep cervical flexors, shortened chest muscles. Weak upper back extensors. So again, and I'm just repeating myself, but just to the variation that we're talking about, increased thoracic kyphosis. So you can see the thoracic area really curved. So those muscles are under length, so they can't shorten easily. So then we need to strengthen those ones. Weak trunk muscles, same thing. And then these people have got more of an anterior tilt of the pelvis. So you can see that little arrow. And hip flexors are short, so that might be the reason why they're falling into anterior tilt. And then they've got the length in the hip extensors, which is our glutes and our hamstrings. So we see this type of presentation a lot if we're thinking about population groups, postnatals, because they're having to carry a heavy load in a short amount of time out in front of them, and to compensate with that, their pelvis falls forward and then they round their back to move backwards to then compensate for their center of gravity. So that anterior tilt is a big thing to be cueing if you work with anyone that is in a postnatal type population. The focus areas, we've talked about neck extensors stretching, pec major minor stretching, so across the front, lower back extensors, so working to strengthen these ones at the lower back. Stretch the ones at the back and strengthen the ones at the front, and then the hamstrings to strengthen because these hip flexors are tightened, so we want to stretch them. Flat back posture, same thing at the top. Forward head position, shortened chest muscles, weak upper back. So you look how flat their spine is. They tend to have the posterior tilt as well, so they kind of dump into their back, and then they are quite long through the front of their hip and strong through their abdominals. So they kind of move quite far forward of the plumb line, and so then they kind of flatten through their back to try and reproduce that center of gravity and that posterior tilt. So their focus areas are same as previously, but again, you're probably going to stretch out your hamstrings and strengthen your hip flexors, not putting a huge amount of focus on the on the abdominals. Obviously, abdominal work, trunk control is always great, but you don't need to completely focus on that. The only other thing I'd say is that they are probably quite grippy around the front, so you want to make sure that you're thinking about strengthening, but trying to find that neutral pelvis position. One thing I haven't spoken about is the mobility aspect. So obviously if they're stiff through their thoracic spine, then you want to mobilize that. So in this case, this person would be probably quite stiff through their mid-thoracic. So you want to probably improve their mobility by doing rotation and extension type exercises. And then because they're quite flat, even in the lumbar spine, you probably want to work on more segmental mobility through there to bring that awareness back into each part of your spine. When it starts to be quite stiff and look the same the whole way down, then you are thinking that person probably has less awareness around their spine and what they need to do, or where they are in space. So when you ask them to do, for example, a bridge, they just lift straight up and all of a sudden they're at their shoulders and they didn't even from their pelvis, and they haven't rolled through the spine because they've either got less awareness or reduced mobility through that area. So that might be something that you can work on rather than doing heaps of hands and straps, because they're already strong in their abdominals and they don't actually have a neutral spine in that position anyway. So then moving into this sitting posture of the desk worker, I've just pulled a few little pictures here, obviously again quite excessive, but just to give you an idea, they do tend to fall into a posterior tilt, as you can see in all of these. They've got angles up on this picture, but I don't think that's what really matters. It's more the fact that they flatten through their lower back, so they lose segmental mobility through their back. They then go into a posterior tilt, and then because they've now become into a sitting posture, instead of how we had the hamstring and hip flexor opposing each other, so one was weak, one was tight, then we've got the opposite, the same happens. So our hip flexor is shortened, so it becomes tight because our hip is in flexion. And then we've also got our hip inflection and our knee inflection, which means our hamstrings are also shortened. So now someone sitting at a desk is going to get tight in their hip flexors as well as their hamstrings. And so that's something to keep an eye on as well, because you might think, oh, they sit all day, so let's just open up through the hip flexor, but then their hamstrings are really tight and are pulling them into a posterior tilt, so they can't actually find neutral anyway. So the desk work or that sitting posture is actually quite different to the standing posture. And although you'll get a lot of findings in the Plumb Line assessment, you might find it can be a little bit confusing because you've got someone who's got a posterior tilt in standing. And so you think, oh, that must be open through the front and shortened through the back. But then when you think about what they do all day, you might have to address the hip flexor tightness as well. The forward head position, this is quite extreme at the bottom. I don't think people are like that all day, every day. Some might be, but we do want to try and reconnect and think about that ice cream. We want to restack each area up on top of each other. So the sitting posture, we've just talked about that, but same as we said at the top, thoracic kyphosis, so more rounded, weak trunk muscles, reduced lower back lordosis, posterior pelvic tilt, and tight hamstrings and hip flexors. So when we're going into strengthen them, we want to work through their neck extensors, stretch them, neck extensors, the pec major minor. So pretty much everyone that we come across, we want to stretch and open up the chest, hamstrings, hip flexors, and then strengthen through the deep cervical flexors, the upper back extensors. And I would also add in the shoulder blade stability here as well to then oppose this shortening through our chest. The hip extensors are getting our glutes working a lot more, and then our abdominals as well. So going on to our cues and dosage, and just before I finish this last slide, please just put anything into the chat if you wanted any more information around those postures. So the cues and dosage, as I said, can be quite hard to plan, especially if you don't have a background in strength and exercise. So I think first of all, with the cues, when we're thinking about someone who has been sitting all day, and I think even if I just go back and show you, so we think about this person, even this person, and that person, they are all quite, I say dumpy, but it's all quite shortened. If you think about where you want them kind of rebuilding like that ice cream cone, and no matter what posture they've got, there's some part of them that shortens a little bit. And so I think in a seated position, if you look at this bottom person, obviously, like I said, it's probably a little excessive, but we think about how round and grippy that person might be. So as a physio, I find often around underneath the shoulders, they're really grippy. So they're really tight from working at a computer. They are tight around the diaphragm, so under the rib cage at the front, and then they're grippy all around the front of the pelvis because their hip flexors being in that sustained position. So when we're talking about cues, we want to think about everything that is going to oppose that shortening, dumping, gripping kind of feel. So you want to think of words like lengthen, create space, be taller, open, lighter through the arms, extend, lift, reach, because you want everyone to almost create space in all their joints and their ligaments and their muscles to then be able to find that neutral position and open up through the front of the chest, through the front of the hips. So I'll try and cue that a lot in the exercises so you can see how I use that, but especially out of the arms, like lift out of the arms, rather than we find our 4-point position and we start to dump and sink into that position. And that's just what they create in a seated position all of a sudden, even though we're in 4-point kneeling. The tactile cues, I think, really encouraging more mobility. So thoracic mobility, if we're doing Mermaid in the class, you want to, if you've got the ability to walk around and see and put your hands on people, which is a little bit harder in this day and age with COVID, but when we get back to that tactile cues a bit more, you want to try and get them moving a bit further than they think they can. So into that Mermaid, you placing your hand on the front of the sternum and at the back, and then driving into that thoracic rotation, or creating a bit of a hold around the base of the ribs and then moving into that position so that they can feel where they need to go or how far they can go. And promoting lengthening or feedback to the areas of focus. So if we're trying to open the front, rather than, you can do it two ways. You can kind of come through and almost spread across the front to then open up. So you're guiding that opening. Or if we're here, we want to shorten through the back. So you might then come and place your hand in the center of the back and then guide the shoulders open that way by shortening through the center. So where you place your hands doesn't have to be too much, and it can literally just be one finger, but you're just giving them feedback, especially because they may not have the awareness. They may think they're in neutral, and then all of a sudden you put them there and they don't even realize that they weren't there to start with. And then when it comes to dosage, so I've put endurance, strength, posture / function. So obviously with everyone we talk different reps and springs, but I think there's two ways you can look at it. So when you're thinking about endurance, you're thinking the higher reps. So you're lighter the springs, because if you're going to get someone to do 30 reps, you don't want them to feel like they can only get to 5 and then they're burnt out. You want to make sure that it's a lighter to moderate resistance and get the reps, because you're working on endurance. You want that muscle to be able to work for long periods of time. So if we're thinking about that to the posture, and we think of a sitting posture or sustained periods of sitting at a computer, they need to do that for 8 hours a day. So doing 6 reps of one exercise may not be enough to get, or it will help over time, but you might not get fast change. What you might find is that you might do less reps, but you might overload and do 5 different exercises. So by the end of that session, they have worked that muscle in different ways and have got the endurance because it's had to work under a little bit of fatigue. And then we go into the strength. So we want the muscles to be strong and loaded quite a lot to be able to then hold our joints and support our posture, support our joints in these postures. So when we're doing strength work, don't be afraid to load the strength up, but then don't ask them to do 30 reps. So if you're doing all springs, make sure that you really know why you're doing all springs and how many reps you're going to do. And I think it's really important to make sure that you do your classes when you're planning, if you can, because you want to make sure that you can do it and get through a whole class before giving someone the same exercise and then wondering why they can't get past 3 reps or that they pull up pretty sore. And that goes to the lighter springs as well. Don't go too light where they don't have the stability or they haven't pre-activated, and then you actually can't even access the abdominals because they aren't strong enough, and then they end up having lower back pain. And then with posture and function, you can do different ways. So you can think about moving to fatigue. So if you're in a big class, I know that's a little bit harder, but one-on-ones, you can watch them and get them to do the same movement until you see that their posture starts to change, or their stability or their ability to do the movement well starts to change. And that will be to their fatigue point. Again, it's moderate to lighter type of springs rather than heavy. Other things you can do is one set of 20 to 30 or a timed hold, so you can get them to either do an isometric hold for 30 seconds or do this exercise for 30 seconds. So I know that's still a little bit vague in regards to the dosage, but those more longer reps, or lower resistance, higher reps is what's going to help to transition into everyday work where you're having to be in a posture for a sustained period of time. So if there's any questions there, please just yell out. But hopefully that kind of helps when you're thinking about this type of population to what you want to work on and how you would add the springs to the exercises. Perfect. So the APPI Pilates exercises that I've just thrown against the areas and focus that we want to target when we're thinking about a sustained seated position, such as a desk worker, are the following. And we're going to go through this in a second in a practical component. So when we're stretching out the front, obviously all of these can be adapted to different areas. So if you've got mat work available or other areas, other equipment such as barrels and the traps table, you can use all those by all means. But just talking about the reformer today, we can stretch out areas by doing a active movement. So for example, the back rowing series open book, or doing hands and straps and mid-back series and arms, you're actually opening up the chest. So you're going to strengthen one area, but you're getting subsequent stretching in another area and lengthening of the muscles. So you want to think about that when you're doing the exercise. You don't always have to just do a perfect stretch that you hold for 30 seconds to get the stretching component. The hamstrings, you can do the standing hamstring stretch and monkey, which we're going to trial today with Penny. And then the hip flexors, standing hip flexor stretch, which is also quite nice. I've got a couple of those in the class plan as well, and a couple of variations to give you with that. Then strengthening deep cervical flexors. So with this one, I haven't done this on the mat, but the deep cervical flexors is the tiniest movement. And if you're really unsure of that, I'm always happy to chat afterwards about how you find and activate deep cervical flexors. But literally, it's like a slight nod of the head. So the chin is slightly saying yes. And you usually have your tongue on the roof of your mouth when you're doing that. And you just get someone lying on their back. And the muscles in the front, the big muscles, don't want to be active when you do that. So when you're lying on your back and you do a slight little tuck, you don't want to feel these big muscles firing. It's almost, when I teach it to my patients, it's the most subtle, boring exercise that you'll ever give them. So you've really got to sell it. But when we do it in a more intermediate way, we use it in all of our exercises that we probably don't even realize. So definitely on the long box, when we're doing the hands or the arms pulling straps, we're having to stabilize. And where we notice someone that doesn't have a strong neck is when they keep pushing out into that forward head position that we've talked about. And if you correct them and they can't stabilize that and they keep doing that, or they then start shrugging up towards their ears, then I would be saying that you probably either have to reduce how many reps you're doing in that position, or you might find that that exercise is too hard for them and have a backup plan or a regression in your bigger classes if you find that. Usually someone that comes up into this position is either weaker in the front of their neck, or they don't have enough strength through their shoulder blades, and that's how you know. So you want to make sure that you don't just say pull your ears away from your shoulder, pull your shoulders away from your ears, because it's not necessarily just because they're doing it for no reason. They might not actually have the strength to sustain the position you want them to. Upper back extensors, I haven't added in the shoulder blades yet, but the upper back extensors, that's your front rowing second position and the offering. So we're just moving forward and back. So that's shoulder blade control while we've got a nice strong thoracic spine. The hip extensors, so that's your glute work. So you've got side glute press, APP, I call it side plie, scooter, and then shoulder bridges. Abdominals, cat arm dissociation, and cat hips. I have done a lot of different Pilates training. So you might know this as reverse abs. There's lots of different names for it. Mid-back series, again, that's your hands and straps. And then, as I said, I didn't speak too much about mobility, but we'll do a couple of things in the classes, class plans. But you've got your thoracic, so rotation extension mainly, and that's your mermaid, thread the needle. And then lumbopelvic area. So we want to improve that neutral spine position. So we're working on tilts and then articulation, shoulder bridges. Just in that part of the lumbopelvic posture, my belief is that if you can dissociate from your lumbar spine to your pelvis, so if you can maintain a lumbar lordosis, a neutral lumbar, natural lumbar lordosis, and a neutral pelvis, and then you can do movements where, for example, hip flexion, and you don't lose your lumbar lordosis, you've got reduced risk of having lower back pain. Because when those two areas can move separately, because you've got awareness, it means you've got strength and control and stability around that area. When they move as one, it's either because there's lack of awareness, or there may have been a pathology, so the person's become fearful of moving that area, or, as we've seen in the postures, the tightness and the weakness in certain areas have created this block in a posterior tilt or a flat lower back. And then there's a lack of ability to come out of that if we don't know how to get there. So cueing that dissociation, which I've done a workshop on before, is really important. And I spend a lot of time with my clients in the beginning days to be able to find that position, because I think that changes everything for your classes. So adding something about dissociation, even if it's just tilts at the start of your class, is a really nice way to at least start to do that if it's a big class. So that is it for the lecture. I'm just going to stop the share. And please, like I said, just let me know if there's any issues or anyone has any questions or wants any more information on that. Otherwise, we're going to now start and go into some of our exercises around the individual component, and then we'll go into the class plan. I'll keep coming back every now and then, just checking the chat. If there's any issues with the sound or seeing what we're doing, then just yell out. Hopefully my AirPods don't run out of battery, otherwise I'll just go onto speaker. Okay, so we're going to come up onto the reformers first, and Penny's going to come and be our model. So the first exercise that I'm going to start with is just Penny's going to come and lie on her back. And I haven't taught Penny personally through a whole session, but what I do know is that she has tight hamstrings, and I would say more of a posterior tilt, slightly posterior tilt. So it's going to be interesting doing these because I'm seeing her individually for the first time, and I've planned the class separately for what we're doing in our workshop. So I'll be able to add in little components and cues to help with someone who might be in more of that posterior tilt and shortening through their hamstrings. And because we're on a lecture, I couldn't go through some of those postures, but if you're not familiar with the anterior tilt, we're thinking if this is a neutral position of the pelvis, an anterior tilt is forward, so those front pelvic bones point down more towards the floor, and then we get that lower back arching. And then our posterior tilt is a tuck under. So you can see that we're really open through the front. So we're probably under length through our hip flexors. And then we often either get a flare of the rib cage, or we then just go into a dumping position all over like that. So once you can start to pick little pieces or significant areas in your postures, then it's really nice because you can start to change that or cue that. And that's probably the biggest part. If you're not using a posture analysis for any reason, like diagnosing or determining a pathology, for example, or why someone's getting pain, the main part is probably using that to then plan your class for exercises and plan your cueing. So if they are someone that is in a posterior tilt, what do you need to say to them, and how are you going to get them out of that and more neutral? What areas are you going to focus on? I think that's a key thing about postural analysis if you're not using it for any other reason. So I'm going to come around on the other side just so that you can see Penny. And for the first exercise, we're just going to find that neutral position. So like I said, she's probably more of a posterior tilt. And so when I cue this, I can sometimes put my hand just on the front of the pelvic bone, or Penny might find that she likes to feel it herself. And if you're in a big group class, you can always do that too. Get them to put their hands onto their pelvic bones and feel where those are, and then see how they roll back and forth. So the feet are onto the foot bar. Heels, I like the heels on the bar, mainly because I find that we're always needing to work glutes and posterior chain. So I just think it's a better position, but it doesn't matter. And then when we're tilting to find our posterior tilt, we're going to roll back to flatten through our lower back. Those pelvic bones will start to point up towards the chin. And then we're going to start to come out of that and roll that pelvis forward to create an arch or a space under the lower back. And so we can just feel that. We can put our hand under the back and we can flatten down and then forward. And I know this is a really basic part and a basic component of any Pilates training, but like I said, with that dissociation, if you can see what they are doing and how hard that is to find the neutral posture, it gives you a lot to work with in your classes and your one-on-one sessions. So once we've done a few of these pelvic tilts, and I'd say go quite excessive, so flatten down nice and deep onto the carriage, and then arch away and create a lower back space, and then find a halfway position, and that's your neutral spine. And you want them to feel relaxed there. You don't want to feel that that's hard to find that neutral spine. It should be a relaxed position. And the beauty about reformer work is that it gives you a lot of feedback. So often mat work can be more difficult because you don't have a lot of feedback from the equipment, whereas on the reformer you can feel if you're starting to go too far into your posterior tilt, you start to feel like your back is flat against the carriage. So once we've found that position, so that's working on our lower back segmental mobility, we'll then move into a shoulder bridge. So I've got 3 red and a blue just to keep the carriage nice and still. Obviously in your classes you can change that resistance, so going lighter will start to bring in more hamstring strength component, whereas when you've got a heavier resistance, you're going to demand more from the mobility and you're going to be more stable, so they can focus on that as well. So the heels are on the bar, hip width apart, and we are going to breathe out on the roll up. We're going to hold at the top on the breath in, and then we're going to roll down on the breath out. So we're going to breathe in and flatten through the lower back. We're going to peel the tailbone up off the carriage all the way to the top, and we're going to stop at the top. What you want to notice is what their back position is like. So when they get too far, they might start to go into lower back extension. So if you push a bit higher, Penny, just so we can cheat, if she goes too far up, then we'll go into extension here. What you'll notice is having tight hamstrings and a little bit more stiffness through the lower back, they won't get into really excessive extension, but someone that goes into an anterior tilt will just collapse into the middle back. So it's important to watch that. So if that is happening a lot in your classes, just get them to lower a slight amount. So just lower your hips down a little bit, and then they'll find their neutral. The other thing you want to think about is the knees pointing towards the wall. So I'm going to say towards the doors. So we want to lengthen through the front of the thigh, and we want to stay in that nice long position through the legs. We want to keep thinking of the opening through that thigh. As we then start to roll down, I want you to go heavy down through the middle back and start to roll one vertebrae at a time all the way down until we get to the lowest part, and our tailbone is the last thing to touch. If you want, cue the anterior tilt. So they feel themselves going forward into an anterior tilt. They roll back on that inhale. They breathe out, lengthen, up, lift, roll, peel through the spine to the top. Hold at the top on the breath in, and then breath out, sinking all the way down. Using that breath out to melt down into the carriage. And we'll just do one more of those. Just a side note that I didn't say at the start, never have your head up. So make sure that the headrest is always flat on bridges, because you don't want to start to put too much pressure around the neck. I always get someone moving and then add the breath in. So I'm doing it a bit more about breath to begin with, but usually in everyday practice, I'll get them moving and then add the breath, because otherwise, if you just add everything in at once, it can be a bit complicated for the person. So then we're going to go into, so that's the bridges, and obviously you can add lots of different components, but the bridging, you're getting mobility through your lower back and or through the entire spine. And then you're also starting to get a little bit of hip extension strength, which is your glutes and your hamstrings. So I'm going to change it now to a red and a blue. And so, like I said, these exercises you probably do in everyday practice, but they are just adding in a specific component to the population you're working with. And then you've got an area to focus on, and you can actually talk about why you might choose that exercise rather than just giving it because you know that it's a nice ab exercise. So short loops, I've got a red and a blue. Hands are going to go up into those short loops. The legs are going to find your tabletop position. And so again, we want to make sure there's no gripping through the tummy. We want that nice relaxed position, a neutral spine. They might want to do tilts here if they need to. Then we want to just focus in on the breath here for a second while they breathe in and out. If someone doesn't have great thoracic mobility, they might find that they breathe too much in the top of the chest. So we want them to start to focus in. Breathe into the back of your rib cage as well. We all say breathe down low, but also see if they can expand around the back of the rib cage to achieve more expansion into that area of your lungs. And then on that breath in, we're going to stay still. And then on the breath out, we're going to draw the arms down by the sides. And then breathe in, release back up. So beautiful, normal hands and straps. When you're thinking about someone who sits at a desk all day, we're thinking about abdominal strength. Hip flexors are probably quite tight, so we want to take breaks if they need to. From a cueing perspective, think length. Create space in the armpits. Almost draw those fingers as close to the ceiling as you possibly can and reach for the bar as you pull down. So we're reaching, lengthening, creating space to open up this whole area where they're probably quite grippy around that shoulder and chest complex. Adding in a chest lift is obviously another progression. When we add the chest lift in, we breathe out, pull the arms down, lift off the back of the shoulder blades. Only do this if they don't have neck issues. Think about that chin slightly tucked. Keep long through the back of the neck. And I always talk about it being a chest lift so that the person knows I'm trying to lift from the chest. Initiate from the abdominal, so the ribs draw down in towards the belly and the shoulder blades lift up and off the carriage. Have a little break. One note about desk workers. If they work in corporate areas, they're often stressed. They've often come from high demand type work. And when they come and see you, this is their time to just breathe and be in their bodies. So that breath work is really crucial to let go of this tension around here. So we want to make sure that we bringing the breath in when we can, but as long as they're breathing, that's the main thing. Especially if they're a beginner, don't complicate it. As long as they are breathing, it's a lot better than if they're holding their breath. Another exercise in this position, which I'm not going to stay on for too long, I'm sure you've all done a lot of it. Take the arms up to the ceiling, legs come up to your tabletop position, and we just draw the arms down by your side and hold. And then we're going to sweep the arms out wide and then draw them back into your sides. We're going to breathe out as we draw down and breathe in as we release. And notice how this is opening up the chest. So like I said, we're not doing a specific stretch for the pecs, but we're opening the chest as we move our arms. So we're actually stretching the front of the body, even though we're strengthening through our lats and our back and our abdominals and holding our hips up at a 90-90 position and then come back down. Millions of variations in that areas, but we can go into circles, we can do triceps, we can add legs, all of the rest. But thinking again, desk work is open the front, strengthen the tummy. So then the next one is we're just going to lie on the side. So I might get Penny to face the computer, and we're going to go 2 reds and a blue. And I think we'll do, oh, you can just throw this off if you want. Yeah, that's fine. We'll use a little block. So it's really nice to have a towel or something to use, especially if someone doesn't have the best control through their neck, because you don't want them to be dropping into this position and then getting uncomfortable through the neck while they're there. When you lie on someone on their side, it's really crucial to set them up nicely. So stack shoulder on shoulder, hip on hip, so that you're not getting any rotation through the thoracic. We want to be able to work through our obliques in the side position as well. So when Penny is lying here, I'm just going to make sure that I can get my hand underneath her sideways. The pelvis is just rolled forward very slightly so we don't get any rotation through the pelvis, and then she's stacked nicely on her right shoulder. The left heel is on the front edge of the bar, and then the knee, hip, and foot are all in the same line, and then we're pushing out to straighten on that breath out. It's quite heavy. She's strong, she's good, but we can drop it down or make it heavier. Just note that if you go too heavy, you'll find that you'll get more quads in this one. So don't think, oh, the heavier I go, then they'll get more glutes. Sometimes you actually just need to do more reps and variations to access the glute if you're not warmed up enough. Of course, with this one, you can also do a turn out or external rotation position. It's just really important to know that when you do your rotation, that it's coming from your hip. So the rotation needs to be from the deep hip, and that hip, that pelvic bone still needs to face directly forward. And only let them rotate their foot as much as the knee and the hip can rotate. So can you just cheat for a second? If we have the foot almost facing the ceiling, the knees facing over here, and the hip bone is probably halfway between those two, then it feels like there's a whole lot of torsion happening. So get the rotation from the hip and make sure that the knee and the foot all match up. So that's obviously glute, hamstring work a little bit, not really in the side position, but at least we're getting a nice drive through those hip extensors. We're working obliques. We need that for our trunk control. We've got a nice controlled, supported spine and neck. And then coming back up. So we're going to come up and do our hip flexor and hamstring stretch. So I think 1 red is enough, but again, you can actually add as much resistance as you want. So the left knee is going to go on the carriage, the right foot is on the floor, and hands are on the bar for stability, so we don't have to make it a balance exercise. And then we're just keeping our pelvis stable and neutral, lower back is in neutral, and then we're pushing out and we're opening up the front of the left hip. Watch for these ones where if you've got someone who likes to anteriorly tilt, they're going to just drop down and sink into this position. So we want to think about tucking the tail slightly and then going out into that hip flexor stretch to open the front of the hip. Drawing back in, you can do that 2 or 3 times. When you do that, you breathe out to press out and lengthen. You might hold on the breath in to maintain that stretch and then draw back in. Adding the hamstring stretch. If we draw the carriage all the way back in, we'll straighten the right leg, exactly the same movement, both pelvic bones face forward, and then the right leg stays straight and we're pushing back. So we're going to see how nice and tight the hamstrings are here. See this position. So if we come in just slightly, just push out and pretend that you don't know what you're doing and just go all the way out. So Penny's watched everyone else in the class and she's pushed out and she's got tight hamstrings, and you can see that then she starts to round through here. So you've got to figure out which way you want to go and what's going to be better for you. So you want to cue length through the spine, push out only until you feel a hamstring stretch and what feels good for you, because that could be enough. And then you're getting the length from the back, but you're not compensating by then rounding and changing what the spine is doing, and then draw all the way back in. So just watch the compensation. When the hamstrings are tight, you'll find that you'll fall more into a posterior tilt, rounded lower back. With the hamstring as well, if someone is quite flexible, lift the toes. So can you try this? And we'll just, and then the toes, and then that will add more stretch in. But again, choose your audience, choose your population, but it's a nice way to stretch the hamstrings. We'll go straight into scooter, which is a great hip extension. I don't think we do enough hip extensor work. I think we do a lot of sideline glute work, which is our glute med, our dropping into our Trendelenburg. But our hip extension is great, because if you think about seated position, we're in almost the opposite of that. We're nice and long through the back. We're working these muscles up the top by just stabilizing. Penny's taken her right hand to her hips, and now she's stronger, working with more strength component of the left arm just to stabilize. She's pushing down through her right heel to work statically through that right glute. And then even though she might not be burning in her left leg, we're getting nice hip extension moment through here. So even if it's just a hip mobility aspect on the moving leg, great. I've just kept it on that red spring purely just for demonstration, but you can add as much as you want on. But again, make sure that you don't go too far with the resistance, because otherwise you'll start to get more hip flexor and quad. Going into our back row series. So I'm just going to check to make sure no one's asking any questions, and Penny's going to have a seat facing the back of the reformer. We're all good? Perfect. So I might start with the red spring, and then I might get Penny's feedback as to what she thinks with the resistance for her. Yes, perfect. So great little add on here. So if someone is really tight in your classes, in their hamstrings, and they fall into these posterior tilts, if you put a block or something underneath their bottom and lift their hips higher than their knees, you'll open up the front of the hip. That's also a good little clue for someone who has a hip pathology. So if they tell you they've got something wrong with their hip, FAI, CAM lesions, things like that, labral tears, have the front of the hip open, so the hip higher than the knee, and that will be a lot more comfortable. You won't get as much gripping. So this here, if you have your hips slightly higher than your knees, you're going to be able to find more of a neutral lower back position, less of a posterior pelvic tilt, because you won't get the wrapping of the hamstrings underneath. You can obviously also put them up on a higher box. You can bend the knees as much as they need to. You can cross the legs if that's comfortable. So you can change the length of the legs as well to make it a shorter lever. With the straps, we cross them over each other, and we thread the arms through the long loops and up around the elbows. And so then the main points that Penny's thinking about is the length again. So we're growing taller out of the crown of the head. You can, if they've got buns on top of their head, you can gently draw the hair towards the ceiling, gives them a nice feedback, obviously not yanking it. Lengthening down through the spine, but creating a nice natural curve here still. We want to stack down nicely onto our sit bones. And from here, we want that slight tuck of the chin and keep the length of the neck. And then we're taking the palms facing each other, and we're thinking about opening a book. So we're opening the elbows out wide. Note that if someone's really grippy around their shoulders and their neck, just drop the elbows lower than shoulder height to find a really nice position to work that posture without it being too much for their neck. Opens up the front of the chest, almost undoes this position of where we are all day sitting at the computer. We breathe out and open, breathe and release. What we want to do is watch that someone that's an anterior tilt pelvis doesn't flare through the ribs. But for our desk workers, we're thinking length. We've got control through the chair, through the deep neck flexors. We're opening and stretching the front, and we're strengthening the back. Does that resistance feel good? Yeah. And then coming down. So she's done about 15, probably close to, and that was in a red. So that's okay. Then cat arms. So then we're going to drop the straps off to the side. And we're going to come up into kneeling facing the back of the reformer. I'm going to go a blue spring. Feel free to try this on lighter or heavier. We're going to kneel the back, towards the back, knees against the shoulder pads, hands reach out onto the rails. Great 4-point position here to start to change that person's awareness about their spine. So we want to think tailbone pointing to the back of the room, a slight natural curve of the lumbar spine. So really be mindful of not getting someone to be too rounded through here. We still want a slight curve. We want length through the spine, and then always cueing that neck. So again, if someone's got a bun on the end, it's really nice to just do a gentle little pull, but it's fine to also come in and then just gently tuck that chin, and then almost create length by just dragging your hands along the back of the neck to show that person where they want to lengthen from. This is the point about the shoulders as well. We don't want to grip, so we want to think hand might be here, lift into my hand gently and hold that position. So keep pushing out of those wrists. If someone's dumping into their wrists and they're getting sore wrists with movements, it's often because they aren't strong enough in their shoulders. So they just need more practice on the weight bearing aspect of it, but also more strength around the shoulders. So the first one is the arms. So the drawing, you're drawing your head forward towards this mirror by using your arms to pull yourself forward. So the carriage is moving towards the back of the reformer. We're going to breathe out and in on the release, all the way forward. Sometimes a nice cue is think of like a turtle coming out of its shell. So we're trying to reach that head forward, keep the length through the spine. The crown of the head to the tailbone is one long line. And then we might hold on the next one. So breathe out, draw yourself forward, shoulders stack over top of wrists. We hold here, don't grip around the shoulders. And then just gently use your lower abdominals to draw your knees towards your wrists. And then release. Using the lower abdominals, not our hip flexors. So we want to activate from the deep abdominals to pull those knees towards the wrists. Sustained hold in this position like we talked about with our dosage. So if I'm doing this for 30 seconds, that's a sustained hold for Penny to work on her shoulder control, her neck position, which is what she has to do all day, every day. Have a break when you want. And in that position, we've got gravity coming down. So we are opposing gravity. So that's where the resistance is. That's why the deep neck flexors work. We've got mermaid next. We've got 2 more exercises. Oh, sorry, 3 more. So we'll do front rowing. So turning and facing me. So again, I think we could probably go a red spring. You're going to kneel. Yep. We're going to try the kneeling position rather than seated. You could do a red spring here. If you haven't taught this exercise, the counterbalance is a little bit daunting for some people. So sometimes I like them to say kneeling onto their heels, so bum back onto their heels first. And once I've got the activation or the movement pattern, then they come up higher. Penny knows what she's doing, but I'll just show you anyway. So a red spring, but blue if you're feeling they're a bit weaker and you want to get more reps. So the elbows are bent in by your side, and then you're just lengthening the arms all the way forward, reaching. So often we counterbalance. So we want to think about the length, crown of the head, spine, nice and long. Breathe out, straighten those arms out in front. Again, don't reach them too high if it feels like it is going into the neck. Now, if you feel okay, come up into a high kneeling position. And staying up there. So again, we're opening the front of the hip here. We want to be controlled from the pelvis. So we want to be strong, and we want to make sure we're not shifting our bottom back behind us and finding this little shortened hip flexor position to stay there. So think about lengthening and opening the front of the hips. We want to create space down the spine, slight little tuck of the tail if you find that they are falling into an anterior tilt, breathing out, reaching, and making sure as they come back in, there's no flare of the rib cage. So that dissociation term that I was using before, we're focusing on that pressing with the arms and being able to stabilize with the thoracic. And the last one in that one was the arms are together in front. So we push the arms forward, palms face together, and we open the arms up with a slight elbow bend and then draw them back together. This one, watch for the chin poke. So as they open the arms up, stretches through the front of the chest, beautiful. But then as they do that, they want to drop forward with the chest. So we want to cue length of the back of the neck, slight tuck of the chin, keep the neck and head still while we're moving the arms. Beautiful. Then come all the way back in. Okay, mermaid, great mobility exercise, which we probably all have done. Red spring is really nice. Yeah. Right shin goes up against the shoulder pads, left foot up against the right thigh, left hand in the center of the bar or slightly behind the shoulder. Push away with the left arm, right arm comes up and over, reach. I like to do this one in segments, and I'll show you this in the class as well. I like lateral bending first. So create a heaviness down through the right hip. Lengthen through this right side waist. We want to lift out of the left side waist and reach that hand towards the door as far as you can, and then gently come back up. So lateral bend is really important. We grip a lot when we're sitting at a computer. We want to be open through the chest. Going again, shoulder comes down to, ear comes down to the shoulder. So we're not poking the chin forward or starting to rotate already, and then we reach back up. On the next one, we add rotation. So as we go up and over, we hold, then we add the right hand to the bar. Everyone learns this a little bit differently, so don't worry if this is a different variation to you. I always cue right shoulder down, left shoulder up when I'm here though. So we want to push away and lengthen and try and get those arms nice and straight. And that right shoulder wants to start to drop towards the floor. Tuck the chin, look straight down into the springs. Right hand comes back up to the ceiling and unrotate to come up into seated position. Right arm up and over. Right hand comes over to the bar, left hand comes out wide. And this one, find your that rotation stretch, lengthen out, push the tailbone away from the crown of the head. I've got my hands here to guide that. So I'm gently creating a heaviness down to the pelvis. I'm trying to encourage lengthening through the spine. I might also, like I said to you, add the rotation. Right hand comes around the base of the rib cage, left hand on the other side as well. And I'm adding in rotation. Then I want to add extension. So I'm going to place my heel of my hand in the center of the back. I'm going to take my right hand to the hip, and I'm going to ask Penny to lift the chest and bring the chest up and over the bar. So you're going to pull yourself forward, up and over. So I'm trying to encourage that extension through the thoracic spine, and then she's going to press away and do that 2 more times, staying in that position. When I'm doing this, I'm encouraging thoracic extension because we straight away always want to move to our lumbar spine. So I want to encourage that mobility in the middle back where we get really stiff. You could encourage a breath in on the lift because a breath in is going to expand our lungs and our rib cage. So you might actually get some passive mobility through the rib cage by actually changing your breath pattern and doing a breath in when she moves. And then coming back in. Beautiful. And then the last one is just the long box. So we're going to bring the box up onto the reformer. And then we might lower the foot bar out of the way. And then I'm just going to do a blue because Penny's going to do an entire class in a second. So I'm going to not work too hard. So lie onto your tummy with the chest just off the front edge. You can talk about that at bra or sports bra strap is a kind of area, but obviously guys often in the class as well. So just off the front edge of the chest is fine. And then the hands are in the short loops, or if you want heavier, you can go higher up onto the pulley, onto the ropes a little bit further. We want to make sure we're lengthening through the spine. So the way that I talk about that is pubic bone presses down, belly button lifts up, because then you get a neutral spine and you fall out of the anterior tilt. Once we've got that position, we're just going to pull the arms to the side, so up towards the hips, and then release. So I don't cue the thoracic extension straight away because I want to get this right first. I talk about drawing shoulder blades together and widening through the front of the chest. So as she pulls back, I want you to imagine your collarbones are spreading wider along the chest. So we're creating space at the front. So we're not pulling back still with a rounded shoulder. I sometimes will say, make sure if I feel like I'm cueing and no one's getting it, look down. Can you see your shoulder? If you can, pick up the slack, pull the shoulders back. Add the thoracic extension as you pull now. So as we lift from the middle of the back. Think about beaming your chest forward towards that mirror as you lift up into your thoracic extension, but don't lose your lower back control. That's why I don't cue it straight away, because I don't want them to fall straight into that lower back position or that anterior tilt that we've just corrected. Strong through the legs, so we keep all the legs working. So point the toes or flex the toes, I don't mind, but keep them on so we get activation. And then coming back in. Perfect. Penny's going to have a quick breather for a second. I'm just going to come and check to make sure we haven't got any chats. Perfect. Okay, so just on those notes, I didn't create anything too exciting with those exercises. I just used exercises that you probably all know and have trialed before. Obviously, every reformer is different with springs and setups, so make sure that you try them with your reformers that you use. But it's just probably to show you that when you're thinking about a different or a specific population, you can use exercise that you use every day, but you can tailor it a bit more to that individual by either the cues, the dosage, or the spring settings that you use. So if there's no questions, we're going to go into this flow exercise program. Again, I haven't done anything too fancy. What I've done is I've tried to activate and stretch the areas that I want to then finish with a high pose. So like the pose at the end should be the highest one in this class that I'm doing. And then I'm making sure that we finish with one little bit of mobility as well, but incorporating that throughout. Because I'm not teaching for a full 50, 60 minutes, I have reduced the reps, also because Penny's just done all those exercises, so I don't want her arms to fall off. But I would normally either what I've done in this one, where I've used a couple of different exercises, for example, for the shoulders, and added extra reps. So I've done 8, 8, and 8, so then I get 16 plus another 8. So we got that 24, 25 reps. So I'm getting more endurance and overload. Otherwise, I would just stick with one exercise and do that 3 times or something like that. Hopefully that all makes sense, but we'll get started. So I'm just going to set up our reformer. So we need 1 blue spring on if you're doing it with us. We need 1 kilo weights if you're able to, and the bar is up and the box is off if you've been doing the class. Are you feeling okay?
Yeah.
So make sure your bar is in, because we're going to use that and we don't want that to be a safety issue. So like I said, we've got 1 blue spring, we've got our hand weights here, and make sure that your straps are accessible. So I'm going to put the straps just on the shoulder pads, and it depends on which reformer you're using as to how that works. You might have the little pulley, little things, poles at the back that you can just attach them to, and that might be nicer and they won't get in your way. So we're actually starting back into Mermaid. So we're going to start facing the computer. And so we've already cued this, but we'll pretend that we haven't. So we're coming into the room, and when you've got a desk worker, this is probably just a little bit of chat, but we want to make sure we think about what they're coming into. Usually, if someone is coming in and they are in a high corporate job, they're coming in at 5 o'clock on a Monday or even on a Friday, they've had a busy day of meetings, they're in a high stress environment, they've stared at a screen all day, and this is their time to start to settle into their own movement and their own breath pattern. And I want you to make sure that they are starting to think on that. So you want them to take away the focus of what they've done during the day. So you might set an intention. You might say, I want you to just notice that if you start to think about your day or what you've got coming up ahead, just to bring your awareness back into your breath. And often that's why we use the breath, is because we bring in a bit more of the mindfulness in that present moment. And also you might think about with your music and your setup. So if they've had a really busy day and it's been full on, you might think, okay, I'm going to do more stretching mobility today for this class. I'm going to bring the music in to suit that. So it's a lower tone, more relaxation. Or you might be thinking, it's Friday afternoon, they're all going to be so tired, so I'm going to have a high energy class. I need music to match that to get them up to the level that I want them to get to. So music is really important for that. I'm obviously not using music today just because you won't be able to hear me. So we're going to think about today as well about our breath, and we want to think about, we're trying to create more space in this thoracic cage. So we want to think about that opening, we want that mobility, we want to get you really feeling nice and stretched and to undo that sitting posture that you've had all day. So we want the left hand to come to the bar, and the right hand is going to sweep up and over. As you push your way through the bar, we're finding a nice lateral stretch. And we're going to do this 2 times. And as you move through here, just notice what's happening in your body. Breathing out as you reach the arm up and over. Breathing in as you return. Let's do one more, all the way up and over, hold. And then I want you to take the right hand to the bar. You can take your left hand a little bit wider and really focus on that rotation. We're going to lengthen out a little bit more and rotate. We want to lift that left shoulder, drop the right. And I want you to then lift up into a nice extension position where I'm going to lift your chest and pull you forward up and over the bar. Press away. Take the right hand to the ceiling, coming all the way back up into sitting. Keep the left hand where it is. We're going straight into that same movement, up and over, reach. Right hand comes to the bar, hold, lengthen crown of the head, tuck the chin slightly. Drop the right hip down a little bit lower, right shoulder down a little bit lower, create space. Without my guidance, lift the chest, pull yourself forward, up and over the bar. Pressing all the way out. Hold that stretch for 2 breaths. Bring your awareness into your breath, into your rib cage. Breathe in and out, fill up. Breathe out, let go. And then gently coming all the way back in. We're going into jumping mermaid, and I don't think Penny's done this before. So we're going to take both hands to the bar. We're going to bend the elbows and we're going to just lower down. Just start by just gently, without jumping off the bar, just push away with the arms and then draw your carriage back in. So we just get the idea of where our spine is in space. And then when you're ready, the movement is going to be that on the next push, you give quite a nice little push. We come upright and then we come back in. When we come back in, we're catching ourselves on the bar. So we want to give a nice push and then come back in. We want probably a good, you'll start to get an idea of how much push you need. This is a nice way to passively achieve thoracic rotation with a little bit of strength work here as well. Once you've got the hang of it, I want you to do 3 more. Think that you're holding a beach ball as you rotate and swing your right arm around and get as much rotation as you can. Perfect. When you teach this in the class, everyone crashes for the first 3 or 4 times. So do a few practice ones and then add it on, but it's a really nice one to add in. Once you've done your mermaid with rotation, we're coming into 4-point kneeling facing the computer. So coming into kneeling with your hands on, so you're coming facing the computer. Yep. You're like, where's the computer? So come up onto your knees with your feet hanging off the back. That's all right, face that way. Grab the strap that's to the right of you and bring your knees back to the edge of the carriage, all the way back. Yep, and your left hand's going to be on the carriage. Perfect. Yeah, you can go, and so we're going to hold that in our left hand. The right hand's going to go over top of the strap onto the carriage. Depending on which reformer you've got, be careful of fingers. So what we want to do is make sure those hips are directly over the knees. So we want to bring our knees back as far as we can. Our hips are stacked over our knees. We're long through our spine, tailbone pointing back. Left hand is under the right. So the right hand is over top. Yep. Perfect. The strap goes along the headrest. So slide it across the headrest. Yep. Yep, and hold there. Perfect. Then from here, we're going to bend that left elbow a little bit as we pull it through and then open the left arm out to the side. We want to bend the left arm back in and sweep across. So it's like a thread the needle. So everyone will naturally start to add in rotation. You can rotate towards that mirror as far as you want, and then we can push out of that right arm and we can add a nice extension towards the doors. Breathe out as you pull through, open through the trunk, squeeze the shoulder blade, and keep connected into your right arm. We're doing 3 more. Breathe out to pull. Keep a slight tuck of the chin. We're working on rotation and opening through our pec. Last one. And then gently coming back in. We come up into high kneeling. Right hand now holds the shoulder pad. We stay facing the same way. Right hand, sorry, holds the strap. We have our left hand onto our hip if we need that as a bit of a reference point to find neutral. Our right arm is going to go into a shoulder press. So the palm faces forward. The right hand pushes straight to the ceiling. You can go long strap if you want. And you can go closer to the shoulder pads if you feel like it's too heavy. From here, drive the arm straight up and be careful not to go into a lateral bend. So we want to work hard in the shoulders. We're only doing 6 here, so let's do another 3. Palm faces forward and make sure you can only just see your arm in the periphery. You don't want it too far forward. We want to keep the shoulder blade connected. So like I said, I'm doing less reps just to get through each side. Last one. And then gently come back down. We're going to place that strap over top of the shoulder pad again. Lie onto your right side and place your left foot onto the foot bar. You can have your headrest up or down, and you can have your block underneath you. I've got 2 red and a blue on. We're going to have that left heel slightly forward, stack onto our side like we did before. We're pushing out to straighten the leg. Drive through that left heel, squeeze through the glute, nice and long through the leg. We're going for 10, so we've got about 7 to go. Breathing out as we lengthen, breathe in as we draw back in. You can have your left hand wherever you want. Sometimes it's nice to have it on the crease of your hip. As you bend in, you want that crease to deepen. We don't want to be tucking under through our pelvis. I want you to think that you're getting true hip flexion. So that's a really nice way to think about it. Make sure that there's a deepening of the front of the hip crease, because if they don't have that, they're tucking under and they'll feel that. On that last one, just stay halfway, turn the foot to the ceiling slightly, and then keep going here for another 10, all the way in, all the way out. I'm using this to start to build a bit of strength into the glute, but I've got more coming up. So I'm just trying to find an activation pattern. Breathing out to press away, breathing in to draw in. Again, making sure that the foot to the knee and the hip are all rotated at the same amount, not one more than the other. Shoulders are stacked on top of each other. Let's make this 2 more. Last one, draw the carriage all the way in. Slide the ball of the foot to the bar and lift the heel, find your neutral foot position. Push out halfway, hold here, lift the heel up, hold that position. I'm going to get you to pulse here in and out just for 10 little pulses. 3, 4, we want a bit of calf strength as well. Try and get a full body, even though I've got a population that I'm working on. Once I've done my 10, I'm holding halfway, and then I'm lowering my heel down and lifting my heel. This surprisingly will work calf because it's our soleus, because we've got a bent knee here rather than a straight knee. So gas drop with straight leg, soleus with bent knee. But we're also going to get a little bit of glute. Can you feel any glute with that a little bit? Yeah. And then once you've done your 10, come all the way back in. Then from here, I'm going to change the spring, but Penny's going to reach up and grab the strap. It's a 1 red spring, and we're placing the top foot into the long loop. We're going to make sure that we're restacking, so that top foot goes into the long loop. We push all the way out to straighten the leg in line with the foot bar first, and then just find your nice long posture. I always spend time when I'm teaching big group classes to set up, because there's always a couple of people that are half rotated back or they've lost that position. So left shoulder stacked on right, hip stacked on top of right, and then you've got to have that pelvic bone facing forward. From here, we're lifting and lowering. All I want you to focus on first is initiating from the glute. Squeeze from the glute to lift, even though the foot is what's in the strap. We're going for 10. Make sure that as you lift your top leg, we're not lowering through the lower waist. So that top leg will often cause a collapse through your waist. So we wanted to work glutes with these office workers. So we're working our glute med in this one first. Once we've done our 10, we're going to bend the knee to a 90-90 position and hold, making sure we haven't lost our position. We're going to keep the thigh, so from the knee to the hip really still, and then extend the leg forward and bend it back. So we're trying to keep that carriage still. So we drag it from our heel back toward our bottom, and then we're working our glute and our hamstring a bit more here. You'll notice people will start to drop their knee towards the floor. So we want to keep that knee just lifted off the rope as much as possible. We'll do 2 more, continually breathing. And then once you bend the knee, we're going to let that knee come forward over the bottom knee. So we're coming forward. Yep, almost like you're crossing your leg. So it literally looks like that. Then initiating from your bum, we're lifting the whole leg up and down. You'll find that, just push it down a little bit, you'll find that people will start to pull it towards their chest. It's just because they're getting used to the tension. So cue that. Make sure it's almost like you're crossing your legs, and then squeeze and lift that knee to the ceiling. Rotate from the pelvis. And with this one, I don't mind a little bit of rotation because I want that full burn in the glute. How's that going, Penny? She's burning. Hopefully a couple of you guys are on the reformers and feeling it. Once you've done your 10, let's say 1 or 2 more. I want to keep the foot in the strap, but prop up onto the right forearm. So remember, we wanted to work obliques and some of our abdominals. So it's a little bit more challenging. And if someone can't do this, you just keep them down. But their right forearm is on the reformer. And if they need to, it can be either on the headrest in front of the shoulder pad and holding onto the shoulder pad. The main cues here is to think of lengthen the spine, tuck the chin. A really nice one is if they get uncomfortable in their neck, tell them to look towards the floor. That will take the pressure off their neck. Otherwise, they're facing straight ahead. A lower waist is lifted. The left hip is lifted just to where they feel comfortable, and then they're pulling the knee towards their chest. This one isn't for everyone because 1, it's heavy, 2, it's a lot to focus on, and 3, if they've got a hip pathology, it doesn't feel great. So you just got to make sure you're keeping that in mind when you teach this, and have a regression if it's too many things to focus on. 10 presses here. And once we've done our 10, we're gently coming out of the strap. We're just going to take the strap. We're going to still hold it, but we're going to sit on the side of the reformer facing the computer. And we're just going to do a quick little glute stretch with that left foot over top of the right knee, and then leaning forward to get more stretch if we need to. Hold that for 2 breaths. This is always a nice way to bring everyone back to the same rep. So if you feel like some people move faster or slower than others in your class, it's a nice way just to get everyone to come back to start again. Then they're going to take the strap and stand up facing the back of their reformer. The strap's going to be held in a short loop or long if it's too heavy. Feet are hip width apart with as much rotation as they need to, depending on their ankle range. And gently, as they go into a squat, pull into a row. Both. Yeah. Now you'll find as they go into it, if they lose balance, they've got to go back a little bit. If it's too heavy, they've got to go forward. So they have to kind of figure out the difference in the weight distribution from the strap and the resistance that they've got on the reformer. Again, I've got one red. A blue spring is also pretty good if you're finding that's too heavy. So we're doing 10 of these. Let's say we've got 4 more. Thinking about a nice deep squat, lowering down, we're getting work accessing through our glutes. We're working through the muscles in the back. We're opening the front of the chest, and we're thinking long through the back of the neck. On the last one, we're going to hold down there and do 6 rows here. So we've got strength, center of balance. So you see, it takes a little bit just to adjust. And then once you've got it, dig down through your heels. Keep a slight tuck of the tail if you need to. Watch for any rib flare. Squeeze through the shoulder blades, draw the elbows back. And once you've done your 6, you can come all the way up into standing. Then gently place the strap back, turn and face the foot bar, both hands on. We'll go into our hip flexor stretch again. So we've done this already, so I don't need to cue too much, but right foot is on the ground, press all the way out, tuck the tail, open the front of the left hip, and then gently come all the way back in. Just do 2 of these and then go 2 of your hamstring stretches. Most people will know these stretches, so it's nice to just give them a thing to sink into, not giving too many cues so that you're not always having to listen and focus. They can lift the toes of the hip flexor, of the hamstring one if they are more lengthened through their hamstrings, or keep the foot flat. And then coming back in. And then as a variation for the hip flexor, I want you to lift your foot and slide your knee back against the shoulder pad. So the left foot comes all the way back and you wedge it right in there as close as you can. The right foot stays where it is. Keep the tuck of the tail. This is a hip flexor stretch, so you're going to feel the stretch faster than when you have the knee forward, so note that. And then draw the carriage back in. Really nice for our office workers. We're really stiff through the front of that hip. We need to open up through the front of that hip to get that nice stretch in the hip flexor. So from here, we're going into we'll go into your scooter. So then we'll grab this, the weights. I've got 1 kilo. If you want heavier, that's absolutely fine. They're just on the foot plate. That's where they were just resting. So I set that up at the start. Then the left knee is lifted, the elbows are in by your side, tuck the chin, lengthen the spine, and then go into a tricep extension as you push that left leg back behind you. We want 15 scooters. Often I always cue. The left hip, so the one that's on the carriage, needs to roll forward, and the right hip needs to push back. Sink back into the back of the hip joint. Feel the glute engage by pushing down through your right leg. Open through the front of the chest, squeeze those shoulder blades together very subtly, and think about widening the collarbones. Tuck the chin, lengthen the neck. Once we've done our 15, then we're coming back in, we're placing the box into short box position. We're going to keep the red spring, but if you feel like it's too heavy for anyone, then I want you to drop it down to a blue spring or go long straps. We're coming up into a seated position, facing the bar. We're going to reach back, and that's why it's always good to have these straps ready, because you don't want them to get off the reform again. We've done this a bit, so I'm only going to give a few reps for Penny, but otherwise I'll do 10, maybe 8 to 10 of each. We're going elbows in by sides, and we're just going to press the arms all the way forward. I've just taken the pressure off the legs for a second because we did some squats and glutes and everything. I want to come back and use that again in a second for the quads. So I've got an interlude and I'm thinking of sitting posture. So making sure I'm cueing, relax the front of your hips, not gripping through your hip flexors as you're sitting there. Grow taller out of the spine, reach the crown of the head to the ceiling. Try not to move the spine as you lengthen the arms forward, and then take the arms onto the next one all the way up and open and close into our book openings or perfect. And you can combine this as well, and you can bring the arms together, bend the elbows, and then do that one more time without overloading us. But I would do, say, 6 to 8 of each variation if it's light enough and if we haven't done too much beforehand. And then gently come back in. I'm going to maintain the red spring. I'm going to put these straps back where they were, just on the shoulder pads. And then the heels of the feet are going to come up against your box. This one is a little bit tricky. And if you haven't done it, or you haven't taught it, sometimes I either get on a reformer and show them. If someone's scared or not very good with balance, I put all springs on to keep them safe, but you make sure you change it again. Otherwise, if I've done it before, I walk them through it. So the heels are against the box, and we're going to lean forward. We're going to come up into standing. One red spring means it's quite wobbly. Once they're up there, we're getting the balance of it, and the calf will be a little bit on fire. Yeah. And then we're reaching the arms forward as we go back into our hips and then come back up. And like I said, I haven't taught Penny before, so we can change this if we need to. It's always good to be able to change on the go. I can add more springs. I can take a different variation. We can do it on the ground if they don't have the foot or mobility like in the toes. Then I want you to do 3/4 range. So then go almost all the way down, almost all the way up for 6. So 3/4 of the movement. And then once you've done that last one, I want you to hold halfway and do 6 little pulses here. So just really to get a good burn of the quads. Is that burning yet? Once you've done a six of your pulses, I want you to hold and count to yourself 6 seconds, and then you can come down for a quick little break. If you're really mean, you can redo that whole thing again. Our quads will burn, but we are strong in our quads, so it's nice to try and see if they can do it again and give them a bit of a challenge. We're on one red spring. If you want, we can go, maybe we'll try the jackrabbit. We're going to go into ab work. Again, we can change this. If the box is in the way and doesn't feel good for their feet, we can change that. But otherwise, the hands are now going to go to the bar. We're going to then be stable through our shoulders. We're going to lift our bottoms up, and we're going to push back and find our plank. Everyone calls this different things. I think it's long spine or long stretch in APPI. Jackrabbit is another one. Holding this position, so that's pulsar. We're going to draw the knees in underneath us. The shoulders over the wrists is a lot easier than shoulders away. So we're thinking about scooping from the belly. Dissociation from lumbar spine to the pelvis. We want to draw all the way in. One more, and then I want you to draw in, crash the carriage, so come all the way in, and then lean back and see if you can hover into a squat. She's good. And then she refines that length. Hands come to the bar, press out, find plank. Draw back in, hold, and then come all the way in, find your hover into a squat. Always got to crash the carriage when you're doing this one. Press away. And then very last one like that. Come all the way in, quads will be burning, especially on a red. Come all the way in, same thing. Last one. We're just going to really, really kill her today. So lean back, find your little hover. Last one, arms come down, find our plank. So obviously at intermediate class, we go into rocket or long, again, I can't remember what APPI is, but we find our long spine, and then we just draw our arms forward and back for 6. What do you call this? With just the arms.
I've just got to lose the box because my long, my length.
What do you, yeah, of course. What do you call it? Everyone finds it calls it something different, but we're using the arms here to draw in and out. This here, we want to make sure we're not gripping. We want length in the spine. Again, create space. Lift out of the arms. Draw yourself forward, up and over the bar. That's why I call it rocket. It's kind of like you're lifting up and over rather than just flat. And then come all the way back in. Knees come down to the carriage. We're going to try monkey. This is quite a hard one. It's quite nice to show. We can do it with the box, and also you can do it without the box. I think it's taught both ways. The feet come to the bar, and just play around with it if the feet are on the outside or on the inside of the bar, of the hands. So the hands will reach forward onto the bar. So for this one, if you are tight in your hamstrings, less of your gripping with your hands, so only a light touch will be easier to access the hamstrings, but we'll play around and see what Penny feels as well. So as she pushes away to straighten her legs, we'll go toes on the bar to give you a bit more access. She's trying to lengthen out through her hamstrings. What you'll find is that someone with tight hamstrings, they're going to compensate with their upper back. But if they're getting a nice hamstring stretch, it's not a bad thing to still trial. And as they get stronger, more length in their hamstrings, they'll start to lengthen through their trunk and then draw back in. The other option is to have the feet inside the hands. This was harder. So if you go change your feet position. Yeah. Yeah. And then now push. So then you'll find it's harder to get the length, yeah? And then again, so that's the way you can cue and modify. It's not always great for everyone, but some people love that length. And if you've got 20 people in the class, you want to tailor it to the people that need it as well. So you can still get something out of it. Just be mindful of gripping or anything through your lower back. So do one more of those if that feels comfortable, and just hold that stretch on the last one. And then gently coming all the way off. So we're going to lower the foot bar down, and we're going to stay on the red spring. I'm not going to do, again, too many reps, but I would usually do this. We're going to keep the box, and we're going to keep the box up there. Again, I would do lots of reps of this if I wanted to add more endurance. So we're going to start. So just be mindful with having feet up onto the foot plate, and we're using our weights. I like to start with something that's a bit more stable. So the weights are onto the box, and the hands are going to hold onto the weights. And we're going to have our right foot onto the carriage. So from here, we're going to find another stretch first. So the hands stay down, and we're going to push away and find a nice opening through the front of that hip, and then draw back in. We'll just do 2 or 3 of these. And you can round the spine as you come in, to think of more of a flow. So try not to always think rigid and strong. Think of almost like just allow that body to move. Sometimes we give so many cues that people then are afraid to move. So allow everything to move. So push all the way out. Yep, and then scoop and round and come all the way back in. So almost like you're straightening your right leg. Yeah, that's it. And then hold the last one, find your stretch. So push all the way out and hold. So the left leg is nice and long. The pelvis is facing forward, open through that right hip. The right heel needs to be strong onto that carriage. The right hand is going to lift the arm up, the weight up towards the ceiling. Don't turn your head unless you feel really strong here, and then take the right hand back down. Opening to the open side is a lot harder, so I'm here to stabilize, to help. And we're going, you're right, slipping a little bit. Left hand comes up to the ceiling. It's a lot harder, so we want to really cue that right leg. And then if they feel confident, add in the rotation with the head and neck. Thoracic rotation, strength component, glute component, great for everything we need, stabilizing through the back. Last one. Harder, isn't it? Yeah. And then gently come all the way back up and standing up. So the hands are now off the box. We're staying in that same position. We're going into a lunge. So we're going standing and facing that same position. Other way. Yep. So the hands are going to come out in front of you as you go into your lunge. So we push away and drop the back knee down, and then come back up. Just do one of those. Her quads have already worked pretty hard, so I'm not going to completely do too much. Press all the way out and drop. Hold the arms there, open the arms out wide. Pec stretch, nice strong motion. Draw back in, come back out. Do 2 more like that. Notice how we've done things that have prepped this already. We've got some glutes, we've got some arm opening, we've got some control through the neck. So we know what we're doing in this position. And then she's going to come back up, and then on the next one, hold down there and do 6 of just the opening. If you only want to do 4 or so, Penny, just do whatever you feel comfortable. So say I do 6, and then I'm going to hold with whatever one she does as her last, and then just do 4 to 6 little pulses with the legs. So just get the final caning of the quad. So now I've worked endurance. Now I've overloaded every system and then come back in. That's her break to then change and go into her stretch on the other side. So the right foot will be on the foot plate. The left foot will be on the carriage. The hands will reach forward onto the weights again, and she'll find a couple of stretches. So she'll just see what feels good. She'll push away and then come back in to straighten that left leg if that feels good. Open up to the front of the hip, get her breath back. Always have a changing point where you just get a moment to reset. And then on the last one, we hold out there. We stay with that left leg strong underneath the knee, the left heel. And then the left hand will move this time first. The left hand will open up. It's easier to open to the side with the leg in the front than the other way. So as we open to the right, we'd be really mindful of pushing down through our left heel, keeping our left knee facing forward rather than going with the right arm, and strong. You should find glutes have to fire. Alternate for 2 or 3 each side. And then once you've done your last one, if you want to challenge, rotate your head as well, and then come all the way back in and come up into standing. Perfect. Coming up into standing, the right foot stays where it is, left foot stays where it is. We push away into our lunge. The arms come up in front and we hold. Good. And we open the arms out, we close, and then we come back up into standing. So we'll do 4 of these, and then we're going to stay at the bottom and do 4 openings and then 4 pulses. So again, you'd keep the reps the same on each side. I'm just being a bit nicer, depending to make sure your arms don't fall off, but you want to keep that consistency with your reps as well. Keeping grounded through the left leg, the slight tuck of the tail. I always say slight, just subtle, kind of those terms. Otherwise, they really grip underneath and then they're getting too much opening in the front of the hip. They're driving that hip bone forward. 4 arm openings, arms stay open on the last one, and then we do little pulses here for 4. So we're working hard here. Our arms are strong in that isometric hold, and we're holding. And then we gently come all the way back in. Perfect. We're bringing the box off now. The weights come back to the foot plate, and our bar comes back up. We've got to finish the other side for our mermaid set, and then we are finishing with our peak pose. So we're almost there. Second side always goes way faster. Left shin up against the shoulder pad, right foot against the thigh. The left arm goes up and over. Really create space on the top side, close on the other side. 2 like this, and then we'll add our rotation. It's always nice that when people start to feel familiar in the exercise, because then they start to move with you. Up and over, and then add your rotation. Right hand comes a little bit wider, drop the chest towards the floor. Make sure both arms are nice and long. Hold here, kind of try and get a little bit more mobility through your thoracic spine by rotating towards the right a little bit more. Lift the chest and pull yourself up and over the bar into our extension. So we're lifting, keeping those arms nice and straight, and we pull ourselves forward and then press away. Unrotate, left hand comes to the ceiling, and then come all the way back up. Pressing all the way out, and then coming all the way back up last time. Beautiful. We change now to our blue spring. We go into our jumping mermaid for 3. So this one is always nice to try than the next lot, because we've already tried it now. So we come down low, lower down, and then so we bend our elbows in, and as we push away, we're going to come up into a sitting position, and we move towards that mirror. We break that component down so that they don't start to feel like they're going to go flying, and they get more confidence with the movement. Last one. Then we come up into kneeling, facing the other way now. So we're kneeling, facing this back wall, and we're going into our thread the needle one. So we're going to have our knees here, feet this way. So kneeling, take the strap. Right hand is holding the strap, left hand over top of right. Palm faces the ceiling, pulls through and opens out to the side. Add your thoracic rotation straight in. So when you've already cued all this stuff, you don't need to then stagger it or layer it as much. You can then ask them to focus on more. Is their back nice and long? Is their chin staying tucked? Can they focus on the breath? So that second side, you can start to layer more cues if they've already got the basics. And then after that last one, we're going to come up into a high kneeling position, take the left hand into the short loop. We come closer to the shoulder pads. They kind of know where they were on the other side. The left arm is pressing straight up. Remember, we've probably got a dominance in the hand, so we might have to change strap long or short, depending on what suits them. We're pushing straight to the ceiling for 4 without getting any bend if possible, keeping those hips facing forward. Once we've done that last one, I'm going to change it for Penny. She's going to lie on her side. I'm going to grab her block for her. She's going to lie on her left side and go through her glute work. So we're prepping this last side, so then we can add our final 2 exercises, which will work everything we've worked already this afternoon. Pressing away for 10 in and out on the heel. She now knows where she's going to be, stacked on top of the hips, stacked on top of the shoulders, lower waist lifted, length through the spine, keep the chin tucked. All the cues that we focused on with our focus areas. When we did the lecture, it's everything that I'm cueing. So I'm just cueing the same things that I know that she needs to focus on because she sits all day at a desk. Once she's done her 10 here, she turns the foot to the ceiling and does another 10. Rotation, everything. I also cue, be aware of how one side feels different to the other. Doesn't necessarily mean anything, but just be aware of it. It means that then you can always tailor that side to what you need. You might find you have less rotation or more rotation. It's absolutely fine. Just make sure that you're compensating or you're changing things as needed to either get more out of it or to regress if it's too much. Once we've done 10, we've gone to the ball of the foot neutral position and we find a halfway position. Lift the heel of the foot and push out halfway. Then from here, push all the way out, keep that heel lifted, and then keeping the heel lifted, come in and out. Just a few little pulses here. No, just pulsing, just kind of like, yeah, perfect. And then once we've done that last one there, hold halfway, and then keeping that heel where it is, then lower it to the bar and lift. So now that right glute is starting to work a little bit more. Last couple, and then coming all the way back in. She's going to reach the strap that's in front of her and place her right foot into the long loop. We're going to start with just our lift and lower, and it's nice to see it from this view because now you can see how the stability works from her pelvis. So she pushes all the way out, rolling the pelvis forward to make sure there's not too much rotation. Lower waist is lifted. We lift and lower first here. We'll just do 6 on this side. So we don't lose that lower waist. We want to keep the length. We want to initiate from our glute. And then once we've done that last one, we're going to hold and then bend the knee and flex it to our 90-90 position. And then hold that carriage still and then extend the leg out in front of you and then use your glute and your hamstring to drag it back. Once we've done that last one, so 6 of these, we'll do our 6 clams. So then our knee is going to bend over top of the other knee, like you're crossing your knees over each other, and then initiate from the glute to lift the knee, foot, and hip all as one, all the way up, all the way down. Squeezing. Notice I haven't cued as much of the breath because one, I can hear that Penny knows the breath and she knows when to do it, but also we've done so much of that cueing on the other side that now it becomes a bit more natural. Breathing out as we're moving, breathing in as we're releasing. So on the effort, we exhale, and on the rest, we inhale. We keep the foot in the strap now, and we take our left arm and prop it up onto our forearm, either on the headrest or just in front of the shoulder pad. This is a harder version, so we're really thinking about nice shoulder control, length through the lower waist. We want to lift the right hip up to hip level, the foot up to hip level, bend the knee towards the chest, and then press out without losing that lower waist. So you just reduce the range if it's too much. They might even just have to hold that position while the rest of the class is doing 10, and that's hard enough for their shoulder complex. Remember to look down to the floor if it feels like it's too much for the head and neck. Once she's done her 10, and you can just go to as many as you want, Penny. And then once she's done her 10, she'll come out of the strap, come up facing the back of the reformer with the strap to go into the rows. And notice how the transitions become faster as well. So you can cue that in your classes because they should be kind of in tune with everything. So you can just start to transition. That's why the other side becomes faster. but don't lose or go too fast on the actual exercise, because you now know what you're doing. So you still want to cue the slowing down and the focus of the breath and the focus of the posture. See the beautiful squat we've got here. So already there's more confidence with how we're dropping down into the squat. She's strong through her legs. She's pulling the straps towards her chest. We'll make that last one and then hold down there and do 4 rows in this position. So now we're actually encouraging that seated position and working hard to work on the endurance of what they have to do all day, every day. And then gently come back in. The strap goes back to where it was, and she goes into a hip flexor stretch. So the right leg is floating, we're pushing away, we're going into a nice, right knee is on the carriage, left foot is on the ground. Hip flexor stretch first. We'll do 2 hip flexor stretches, 2 hamstring stretches, and then that second variation of the hip flexor where the knee goes back against the what's it called? Shoulder pad. The more awareness that you can give them about their back, around any of that rounding that they might be getting. Can you lift a little bit higher out of the chest? Can you tuck the tail a little bit more? Can you stop the rib flare? You know, I don't always like to talk about negative words like don't do this, but sometimes I think it's a really good way to actually just go straight to the point. Sometimes if you're just always trying to be visual and fluffy, I feel like you can miss the point. So sometimes it's easier just to say no rib flare. And then the hip flexor stretch is the knee goes up against the back of that shoulder pad. So slide it all the way back, wedge it in, and then tuck the tail. And you only have to do one of these just to make sure it's okay on your back, but really looking after the front of that hip and stretching through the back. And then gently coming all the way in. Grabbing the weights, going into your tricep extensions, tricep scooters. So then the left foot is down, we're strong down through the left leg. Our hips are facing forward, right hip pulls forward, left hip pulls back. Going into our triceps, tuck that chin slightly, lengthen the back of the neck. Shoulder blades gently squeeze together, widen through the front of the chest. We did 15 on the other side. And we're about to go into our final pose. So that hopefully if you're with me doing the reformer work, you're really set up for this next part. I haven't done this with many before, so we'll see how it goes. Once we've done this last lot of our scooter, the weights go back. And then we come up into a standing position, we go to 1 glue spring. So we're going into a side plank position. So we want to go into standing in the center of the carriage, facing the foot bar. If you want, you can always cue different things first, but I want to go into a side plank. So it's the left hand that's going to go onto the foot bar, and then the right hand's going to go onto the hip. And when we turn towards the computer, we're going out into a star or into a side plank position with the feet twisting towards the computer. The right foot is in front of the left. Do you feel too slippery? Are you okay? And the hand on the hip. Then from here, we set everything up. You take breaks whenever you need. But we're really lengthened here. We're strong out of the shoulder. The right hand now reaches the ceiling. We hold. Then we bend the knees in and out. We're just going to do 6. It feels more comfortable to open the knees out like a frog leg position, I think, but you don't have to. Then we want to watch for no dropping through the side waist. Shoulders nice and strong. Once you've done your 6, if you don't need a break, I want you to go thread the needle pike. So as you pike up, your right arm will sweep down towards the spring and then release. Doesn't have to be a big range, especially with tight hamstrings, but you're set up for this. You've got obliques. We've done strength for the shoulders. We've done strength for the glutes. We've got our posture. We've got mobility in our thoracic spine. And then one last time on the other side. Change the other side so you can see the view on the other side. So even though this might not feel like it for anyone in the class, we've really prepped this. We've got enough strength, and if you prep it right, they shouldn't get sore neck or shoulders or wrists, as long as it's in the right kind of vicinity of their ability and they don't have any pathology. So the right hand will be on the middle of the bar. Twist the feet towards the back of the room. The left foot is stacked forward and the right foot is behind. The left hand comes to the hip and then straight to the ceiling when you're ready. We come in and out like a frog leg movement and we draw in. We're dissociating from our lumbar spine to our pelvis by keeping really strong through the trunk, then drawing the knees in and not losing our lower back position. We lengthen through the spine, the chin is tucked, the crown of the head is reaching out of the door. And once we've done our 6, if we don't need a break, we go into our pike. We draw the carriage in as we rotate. So we draw in as we rotate. Oh, you're right. So in as you rotate down. Perfect. And we pull everything together with this. Rib cage to hip. So left rib cage down to the right hip. We want to squeeze and wring out that T-towel like it's your obliques through your trunk. And once we've done our last one, our final mobility is to add all your springs on. And sometimes it's nice because if you're in a clinic where you usually have all your springs on to finish the class, which is usually the way, just for safety reasons, it's a nice way you're setting that up already. They turn around and face the back of the reformer. And Penny's going to sit with her bum relatively close to the edge of the reformer, but not where she's going to fall off. And then she's just going to find her way back onto the bar. Hands are going to go behind her head to support her neck. I usually like to go interlace fingers behind the head, run the thumbs down the neck. And then from here, because it's on a heavy resistance, she shouldn't go anywhere. Go feet against the shoulder pads just to feel a bit more comfortable. Start by just extending back over the bar. And then gently coming back in. And if it feels really nice, lift your bum without pushing the reformer. So just keeping still to then go into more extension. You can also stay up there and side bend with your elbow. So elbow trying to close down to one side. So you almost mobilize your middle back. Do you want to try that? So you hold and then elbow towards here. Perfect. And so you're almost mobilizing the spine. And it's only if it feels comfortable for the person. I usually end with this in something like this class. So you could get them to close their eyes. You could dim down the lights, you could change the music, you could get them to focus in on their breath to bring it back to more natural breath or natural rhythm. You can use the breath in to expand the lungs and the rib cage as they're mobilizing, and you could do it on time so they can come in and out of the posture once you've cued it and you've got them in there, and then you gently come all the way down to finish and done. Excellent. How was it? Fine. Hot. She's hot. Excellent. That's it, everyone. So I hope that you got something out of it. Like I said, I'm more than happy to give you the class plan if you want any more ideas. You'll be able to get the lecture notes if you need those, but hopefully you got something out of it. I'll stay around for a couple of minutes if you need anything or you want to ask any questions about anything specific or not even related to what we've done today. But otherwise, hope you've had a good afternoon and enjoy your weekend. Thanks everyone for the feedback. Perfect. No problem. Thank you. Bye, everyone. Thanks so much. Glad you enjoyed it. That's great. Last couple. Any questions, just let me know. As a desk worker, one shoulder sits higher than the other. The one I use my mouse with, is there a way to even this out? It's really hard with the when you're dominant in one side. So often, because we do this with our right side, so and it's hard to just simply say just try and then use your mouse on the opposite hand, in the opposite hand. I know that's almost impossible. I would make sure though, definitely, that you are checking your screens so that when you're doing your work, you're not rotating too much one way, because often that can shorten through the neck muscles and pull that shoulder up. The other thing I would do is just focusing on stretching out through the neck. So even if it means that you have to add in a couple of times a day or through your shift, to just add in some stretches, because often, even if the shoulder is sitting a little bit higher, it might be actually because the shoulder is tight, and so you need to gently try and stretch that out. And then you also probably need to work on the strength underneath here. So we often sit in this position, so if we can work through the back of the shoulder by doing more rows or lat pull down type movements, and you can do that on the reformer with the long box like we did before, or sitting facing the back and doing your rows, those muscles will, and even actually the 4-point one that we did, those exercises will really work those muscles. So to be honest, it's either stretching this area out or strengthening lower down that will actually help that a lot. That's probably the best way to even it out, unless you can do anything about your work setup. Hopefully that answers. If there's any other questions. No problem. Thank you. Appreciate that. Thanks so much for attending, and hopefully we'll see you again soon.